Hello, good evening, everyone. Welcome back to another OET Speaking Speculation Live. This is me, 𝐒𝐻𝐸𝐾𝐚𝐤𝐬𝐧, joining you from Neethu's Academy. So, yes, good evening, everyone, and welcome back. So, today we are going to look into another recent exam model card for you guys. So, I hope you guys are staying safe and healthy and your preparation is going well as well. So, yes. ഇന്നും നമ്മളൊരു റീസെൻറ്റ് എക്സാം മോഡൽ കാർഡ് ഡിസ്കഷനായിട്ട് തന്നെയാണ് വന്നിരിക്കുന്നത്. എക്സാം കാർഡ്സ് ആ ഒരു പാറ്റേണിൽ അല്ലെങ്കിൽ ആ ഒരു മോഡലിൽ നിങ്ങൾ പ്രാക്ടീസ് ചെയ്യും തോറും നിങ്ങൾക്കത് കുറച്ചുകൂടി ഈസിയായി വരും. ഓക്കെ, സോ ഇറ്റ് വിൽ ബി ഗെറ്റിംഗ് മോർ ഈസി ഫോർ യു ടു അണ്ടർസ്റ്റാൻഡ് ദ കോണ്ടെക്സ്റ്റ് വെൻ യു ഗോ ഫോർ ദ എക്സാമിനേഷൻ. അവിടെ ചെന്ന് പ്രസൻറ്റ് ചെയ്യുന്ന സമയത്താണെങ്കിലും ആ കാർഡ് വായിക്കുന്ന ഒരു 3 minutes പ്രിപ്പറേഷൻ ടൈം ആണെങ്കിലും എവറിഥിങ് വുഡ് ബി മച്ച് മോർ ഈസിയർ ഫോർ യു ടു ആക്സസ്. And also, once you're familiar with the context, you won't find intimidated or you won't find hesitant to perform. നിങ്ങൾക്ക് അത്യാവശ്യം യൂസ്ഡ് ടു ആയിട്ടുള്ള കോണ്ടെക്സ്റ്റ് ആണ്, നിങ്ങൾക്ക് അത്യാവശ്യം ഫെമിലിയർ ആയിട്ടുള്ള കോണ്ടെക്സ്റ്റ് ആയതുകൊണ്ട് തന്നെ അത്യാവശ്യം നല്ല രീതിയിൽ നിങ്ങൾക്കത് പ്രസൻറ്റ് ചെയ്യാനും ഒരു കോൺഫിഡൻസോട് കൂടി സ്പോണ്ടേനിയസ് ആയിട്ട് സംസാരിക്കാനും നല്ല രീതിയിൽ തന്നെ നിങ്ങൾക്കിത് ഹെൽപ്ഫുൾ ആയിരിക്കുന്നതായിരിക്കും. സോ ദാറ്റ്സ് ദ മെയിൻ റീസൺ വൈ ഓൺ എ റെഗുലർ ബേസിസ് ഫോർ ദ ലൈവ് സെഗ്മെൻറ്റ്സ് വി ഡു മേക്ക് ഷുവർ ടു ഡിസ്കസ് recent exam model cards with you guys, so that if you're planning to write the exam anytime soon, this is going to be really helpful for you. Okay, so having said that, yes, good evening all of you. So please make sure that you are actively participant in the live segment. Make sure to comment down and let me know the sentence constructions and things that you would feel for each of the tasks that we are discussing. ഈ തന്നിരിക്കുന്ന ടാസ്കുകൾ നിങ്ങൾക്ക് ഏത് രീതിയിൽ ചെയ്യാൻ തോന്നുന്നുണ്ട്, അല്ലെങ്കിൽ ഈ ഒരു രീതിയിൽ എൻ്റെ സെൻറ്റൻസ് കൺസ്ട്രക്ഷൻ ഓക്കെ ആണോ എന്നുള്ള ഡൗട്ട്സോ കാര്യങ്ങളോ സജഷൻസോ റെക്കമെൻഡേഷൻസോ നിങ്ങൾക്ക് ഉണ്ടെങ്കിൽ പ്ലീസ് ലെറ്റ് മീ നോ ആൻഡ് കമ്മ്യൂണിക്കേറ്റ് വിത്ത് മീ ത്രൂ ദ കോമെൻറ്റ് സെഷൻ. ഓക്കെ, സോ ദാറ്റ്സ് വിത്ത് ദി ഓവർവ്യൂ ഓഫ് ദി ലൈവ് part. Now let's get into the live discussion. So I'll show the card for you. You will have 3 minutes to prepare the card, and after that we will start with the discussion of each point separately. Okay, so over to the screen, you can see the card now. All right, everyone, that's the end of your preparation time. So I hope you have gone through the card, got an idea about how this card can be done, and you have prepared the details that is needed. Okay, so yes, let's start from the beginning. The very first thing you have to do when you get a card like this, when you are attending the examination, the very first thing you have to do when you receive the card to prepare is to go through the setting, the background information, and the first task to get an understanding about what type of context you're dealing with, whether it is a known case, whether it is an unknown case. Based on this information, it will help you to draft your introduction. So this is very important that you have a look at the setting, the background information. For those who don't know what is background information, that's a detail which is available just below the setting given with the heading nurse. Once you read that, you will get an idea about what type of context you're dealing with, like whether we know this patient, whether you have spoken to this patient before, or whether this is the first time you're having a conversation with this patient. All these sorts of information can be obtained. Even after reading the background information, if you're still unclear about the context, your first task can help you. If your first task is asking about what is the reason for the visit or things like that, like inquiring where the patient is there, or any questions or statements which is having the similar context, that can tell you this is an unknown case because we don't know why the patient is there. But if it is something like, detailing the findings, examination findings, or discussing the diagnosis that was just made by the doctor, or if you're there to check how the patient is feeling about a diagnosis made by a doctor and all, you can understand this is a known case for sure because we know the patient might be admitted there, or the patient was under the care, or the doctor just examined the patient. It can be any situations like that. So when you go through the context and when you come to understand any of these details, based on that, you can decide your opening statement. And by opening statement, I am referring to the introduction. It is significant that you have planned what type of intro that will be suitable for this particular context that is being given to you. Because when you have a proper start, it will definitely help you to build your confidence to move forward with the communication. You will not be hesitant. You will not be like blaming yourself for making a mistake and things like that because you had a good start. So on the contrary, touch wood, if you had a wrong start or a messed up start, you might keep on thinking like, what did I do wrong, or why did I make a mistake there? So you might get lost of the next portion or the later part of the role play to come. So make sure it is important that you go through the opening statement very importantly or very seriously, and make sure you plan it what it is going to be, because we don't need any stammering, any stuttering, or getting stuck, long pauses in between. So it is important that you have a proper idea about what type of context it is by reading the background details and everything. Try to understand whether this is going to be a known case, an unknown case, and if it is a known case, you have to further evaluate and understand whether this is a first category known case or a second category known case. So when I say all these things, you can understand you need to put that undivided attention and comprehend the details given there to identify all these things, which is pretty simple because we have discussed the steps for that in many lives and in our speaking clubs as well. So I hope it's clear to all of you guys. So yes, having said that, let's have a look at the context here. So it is given as the setting is a GP's clinic. Nurse, you are consulting with a 62-year-old patient who has recently been diagnosed with high blood pressure during a routine checkup. The patient expresses concern and has some questions about managing the condition. Your first task is to confirm reason for visit, discussing new diagnosis of high blood pressure, hypertension. Find out how the patient is feeling about the diagnosis. So from all this information, you have to finalize what type of context are we dealing with. So yes, You guys can comment down and let me know what you think is this context, whether this is a noun case, unknown case. If it is a noun case, which category noun case, like first category or second category noun case. Find it out and let me know in the comment section, okay? Yes, in the meantime, good evening Divita, Shimi, good evening, Indu, yes, Alina, good evening, yes. Let me know in the comment section, everyone. What do you think? Is this a noun case or an unknown case? What is the context given here? From the detail, you can understand the patient has been diagnosed with high blood pressure, and you might be talking to the patient about managing the condition. And the first task talks about confirming a reason for visit. It is to discuss new diagnosis, which is blood pressure, high blood pressure, and they're also there to check with the patient how the patient is feeling about the diagnosis. So which context is the most accurate one? Is it a known case or an unknown case? What do you guys think? So Alina has mentioned it is an unknown case. Can you please support your statement and tell me why do you think it's an unknown case, or which part in the card tells you this is an unknown case? Is it because the setting is GP's clinic? Yes, Shimi has mentioned it is unknown case again. Okay. Shimi, Alina, since you guys have commented on the context, can you let me know why do you think it is unknown case? Yeah, I'll give you a few seconds to type in the answer. Picturize the context in your mind. Bring that picture into your mind and think about it and say, if it is an unknown case, as you guys have mentioned, how is the conversation going to be? Alina's setting is given as GP's clinic, confronted the reason. Okay, I understand the setting part. I'm not understanding the confronted the reason part. Could you please care to elaborate that to me? Why do you think it's an unknown case? And if anyone has any different opinion, please let me know in the comment section, okay? Whether you think it's a known case, unknown case. Look at the portions which is mentioning the patient has been recently diagnosed. And when you read the first task, think about it whether you are meeting the patient or the patient is meeting you. And whose visit should we confirm? Is it our visit, or should we confirm it with the patient whether you are here to discuss the diagnosis? How is it to be done? Yes, I would like to move forward after we get a clarity on this part. Can you guys tell me what do you think? Alina has me given confirm the reason for visit. Okay, so whose visit are they talking about? Is it the patient's visit or is it the nurse's visit? Who is simple at Joycam, okay? I can make the question very simple. Who is visiting whom? Who is visiting whom? Now, if you're taking it as an unknown case, from the context, it has to be understood that the patient has come again for getting more information about how to manage it. Anganayanengil, there should be something mentioned in the background information, like the patient has a follow-up or a review, or the patient has come there to discuss few things with you, things like that. Okay, appointment, etc. So, do you see any of these details there? Okay, I'm seeing some differences in opinion in the comment box. Angelina has mentioned a known case. Okay, Angelina, can you please tell me why do you think it's a known case? And yes, Alina has mentioned patient's visit. Okay, so if the patient is visiting, Alina, Shimi, this question is for you guys. If the patient is the one who is visiting, is it mentioned the patient has come for an appointment to, consider it like that? Yes. Is it mentioned something like that? Monica has mentioned it's a non-case. Okay, so those who have mentioned it's a non-case, I would like to hear an explanation from you guys, and then we can move on to the next point. Yes, come on guys, make it fast. Why do you think it's a non-case? Angelina has mentioned it's a first category non-case. Okay, I'm seeing that. Can you tell me why do you think it's a first category non-case? Can you support the details? What all information do you need for something to be known? Just think like that, okay? For a case to be known, you need the data of the patient available at the hospital. So just answer to my questions. Do you think from this information, the data of the patient is available at the hospital? Yes or no? Please comment down. Just type in yes if you think, yeah, we do have the detail of the patient available at the hospital. I'm not talking about the nurse. I'm talking about the hospital. In this case, it's a clinic. So do you think the data of the patient is available at the clinic? Yes or no? Yes, Angelina, you are consulting the patient. Okay. Yes. Can you tell me whether, just answer my questions, guys, or let's break it down and understand the context. Do you think we do have the data of the patient available at the hospital? Yes or no? And we have learned in order to decide a case to be non-case, the data of the patient has to be available at the hospital. So if we get an answer for that, we can confirm it as a non-case. And on the contrary, if you don't have the data of the patient available at the hospital, it's an unknown case. Okay, so Angelina says, yes, we do have the data of the patient. Any other suggestions? Any other recommendations, anyone? Monica says, yes, we have the data. Okay. Shimi, Alina, care to change your recommendation or your point of view? And let me know whether you have any different suggestions or do you agree with them? Do you think it's a non-case, or rather do you think we have the data of the patient available with us? Okay, so having said that, let me just quickly get into the explanation of this point, because we can spend the entire lifetime for discussing this point. We have too many tasks to complete. So this can be taken as a known case. Let me tell you why. Because it is mentioned, you're consulting this patient. The patient is a 62-year-old patient. The patient has already been diagnosed with it. And the patient is diagnosed with the blood pressure during a routine checkup. Do you see that point? I was actually waiting for you guys to look into that point, but no one mentioned that point. So as part of the routine checkup, the patient has come to the clinic, and during the time, someone, it is not clearly mentioned who is that. So someone diagnosed the patient, means checked that the patient is having high blood pressure. So you're talking to the patient about it. Okay, so this is actually a known case. Okay, now the first task, I asked you the second question, confirm this reason for visit. Okay, so I asked you a question, who is visiting whom? Is the patient visiting the nurse or the nurse visiting the patient? Okay, so now I can see that Shimi, Alina, you guys have changed the point, and I hope it's clear to you guys. Non-case aanulladu clear aayittu manasilayittundennu thonunu. Okay, now it is pretty simple to identify whether it is a non-case or unknown case. Just look at the context and decide on whether the patient's data is available at the hospital. If it is available, then that becomes a non-case. If not, it is not. As simple as that. Okay, yes, recently diagnosed, routine checkup. Very good, good job. Now my second question, please answer this. Who is visiting whom? The nurse is visiting the patient, or the patient is visiting the nurse? Nurse പേഷ്യൻറ്റിനെയാണോ കാണുന്നത്, അതോ പേഷ്യൻറ്റ് നേഴ്സിനെയാണോ? നമ്മുടെ ഈ ഐ എം നോട്ട് ടോക്കിംഗ് അബൌട്ട് ഹോസ്പിറ്റലിൽ ഡയഗ്നോസ്ഡ് ആയപ്പോൾ അവരിവിടെ വന്നു, ആ കോണ്ടെക്സ്റ്റ് ഒന്നുമല്ല. ഈ റോൾ പ്ലേ തുടങ്ങുന്ന സമയത്ത് ഇപ്പോൾ പേഷ്യൻ്റ് അവിടെ ഇരിക്കുന്നു, നമുക്ക് ഈ ഡീറ്റെയിൽ കിട്ടിയപ്പോൾ നമ്മളായിട്ട് അങ്ങോട്ട് ചെന്ന് പേഷ്യൻ്റ് സംസാരിക്കുവാണോ, അതും ഇതൊക്കെ അറിഞ്ഞപ്പോൾ പേഷ്യൻ്റ് നമ്മുടെ അടുത്ത് വന്ന് സംസാരിക്കുവാണോ? എന്താണ് ഫസ്റ്റ് ടാസ്ക് എന്ന് മനസ്സിലാക്കേണ്ടത്. വാട്ട് ഈസ് ഇറ്റ്? ഈസ് എ നഴ്സ് അപ്രോച്ചിങ് ദ പേഷ്യൻറ്റ് ഓർ ദ പേഷ്യൻറ്റ് അപ്രോച്ചിങ് ദ നഴ്സ്? So Angelina has mentioned the nurse is visiting the patient. Okay. Monica mentioned the patient is visiting the nurse. Okay. I hope you can see the first line of your background, which is given as you are consulting. And also, from the basic understanding, you can understand that, or from the basic detail, you can understand that you receive this information the patient is having high blood pressure, and nowhere it is mentioned the patient is visiting you to discuss these things with you. So from that, apparently this has to be considered as a case where you are visiting the patient maybe in some room in the clinic to discuss the present diagnosis and also to the management points. Okay, so this is where you are visiting the patient there, okay, to discuss new diagnosis, which is high blood pressure, that is hypertension, and you have to check with the patient how the patient feels about it. Okay, so yes, Rohini, nurse is visiting the patient. Indu has said patient visit. I hope, Indu, that's clear to you now. The patient is not visiting. Patient visit ആണെങ്കിൽ ഉണ്ടല്ലോ നമ്മുടെ background detail തന്നിട്ടുണ്ടാവും the patient is visiting or the patient requested to see you എന്നൊക്കെയുള്ള രീതിയിൽ ഇൻഫർമേഷൻ ഉണ്ടാവും. അങ്ങനെ വരുമ്പോൾ പേഷ്യൻറ്റ് നമ്മൾ കാണാനായിട്ട് ആവശ്യപ്പെട്ടു, അല്ലെങ്കിൽ പേഷ്യൻ്റായിട്ട് നമ്മൾ കാണാൻ വന്നു എന്നുള്ളൊരു ഇൻഫർമേഷനാണ് മനസ്സിലാക്കേണ്ടത് കേട്ടോ. ഇതിനകത്ത് അങ്ങനെയൊന്നും തന്നിട്ടില്ല. ആൻഡ് ഓൾസോ ഫ്രം ദാറ്റ് വി ക്യാൻ അണ്ടർസ്റ്റാൻഡ് ദ നഴ്സ് ഈസ് വിസിറ്റിംഗ്. ആൻഡ് ഓൾസോ ഫസ്റ്റ് ലൈൻ സേസ് യു ആർ കൺസൾട്ടിങ്, നമ്മൾ അങ്ങോട്ടേക്ക് കൺസൾട്ട് ചെയ്യണം കേട്ടോ. സോ ദാറ്റ് ഹാസ് ടു ബി ട്രീറ്റഡ് ആസ് യു ആർ വിസിറ്റിംഗ് ദ പേഷ്യൻറ്റ്. സോ അങ്ങനെയാണെങ്കിൽ വാട്ട് ഈസ് ഗോയിങ് ടു ബി ദ ഇൻട്രൊഡക്ഷൻ സ്ട്രാറ്റജീസ്? മൈ നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ, ഡു യു നീഡ് ടു ഗ്രീറ്റ് ദ പേഷ്യൻറ്റ്? If you think you need to greet, the role play തുടങ്ങുന്ന സമയത്ത് greeting ചെയ്യണമെന്നുണ്ടെങ്കിൽ please let me know in the comment section. Yes, വേഗം ചെയ്താൽ, do you need to greet the patient? Yes, Shimi, nurse approaching. Okay, please make it fast. Do you think you need the greeting in this context? If yes, let me know in the comment section. Yes. If you think no. Greeting ന്റെ ആവശ്യമുണ്ടോ? Do you have to start with greeting the patient in this context? Ado direct ആയിട്ട് thank you for your cooperation എന്നൊക്കെ വെച്ച് സ്റ്റാർട്ട് ചെയ്താൽ മതിയോ? അത് യൂഷ്വൽ ആയിട്ട് ചെയ്യുന്ന പോലെ ഗുഡ് ഈവനിങ്, ഗുഡ് മോർണിംഗ്, അതുപോലത്തെ ഗ്രീറ്റിങ്ങിൻ്റെ ആവശ്യമുണ്ടോ? യെസ്, എനിവൺ? Answer the questions as fast as you can, okay, so that we can cover the next topics quickly. Greeting, yes, Angelina said yes to greeting. That's correct. You need to greet the patient. We only don't need the greeting if it is a just examined case. Keep that fixed in your mind. Rohini, yes. Good. My next question. Okay, do you need your self-introduction in this case? If you think self-introduction is needed, comment yes. Just type yes and intro. Okay? Because otherwise I'll get confused with which yes you are saying. Greeting in the yes or no, intro to yes or no, confused down. So if you think you need the intro, that means your introduction. Hi, my name is this. Hi, my name is Alina. I'm one of the registered nurse. എന്നൊക്കെയുള്ള രീതിയിൽ പറയണമെന്ന് തോന്നുന്നുണ്ടെങ്കിൽ just type yes, intro. Alina, Shimi has mentioned yes for greeting. Good. Yeah, that's right. What about the introduction? What do you guys think? Do you need to say the introduction? This is a noun case, so think about it and tell me, do you need your intro? Are you saying yes to the intro? Alira mentioned self. Yes, self-introduction is a must because we don't know this patient, right? We know this is a patient, but this patient has these problems, but nowhere it is mentioned the patient has spoken to you before, or the patient is under your care, or you have examined the patient. So we don't know that. So that makes it a first category non-case. So self-introduction is a must. Yes, Rohini, yes. Angelina, yes. Very good. Next thing, do you need to verify patient details after your self-introduction? If you think yes, type yes and V. Just type V, okay? If you think you have to verify the patient details after you have given your self-introduction, type yes and type V. What do you think? Do you need that? All right. What do you guys think? Do you need to verify the patient details before we start? Yes for verification. True. Yes, Alina, we need to verify that. Now, after you verify, you will state the reason for the visit, and that is your first task. You're confirming that you're there to discuss the new diagnosis with the patient, and after that, you will ask how the patient is feeling. This is how you come to task number 1 by following the right strategy. Okay, so as a roundup, you need your greeting, you need your self-introduction, you need to verify patient details, and then you will do your task number 1, and then you will proceed with the further tasks. Okay, good. I'm very happy to know that all of you are on the track. Good job. Yes, Shimi, Angelina, Elena, good. Rohini, yes. Now, my next question for you guys. When will you ask the name of the patient? Okay, I will give you 3 options. Select the option that is suitable for you, which you think is the right and accurate one. So the first one, during 3 minutes, you will ask the name of the patient. Option A, okay, listen very carefully. During 3 minutes, you will ask for the name of the patient. You will start the role play calling out the name of the patient, like, good evening, Mr. David, and then you will do your self-introduction. Now, if you do like this, you will eliminate your verification point because you already called out the name of the patient, right? So, ingane cheyyumo, adu 3 minutes le peronnum chodikada without asking the name during 3 minutes. You will just start with greeting. You don't know the name of the patient. You will start with greeting. You will say who you are. And in the role play, after your self-introduction, you will ask for the verification. Can you please tell me your name? Which one is right? Tell me. If you think A is right, type A. If you think B is right, type B. If you think both are right, just type both. I'll just repeat the options for you. Option A, you will ask during 3 minutes and you know the name. Okay, David is the name. So you will start by saying, good evening, David. So when you do like that, you will eliminate the verification process in the role play. So second option is you won't ask the name during 3 minutes. You will start the role play usually with the greeting, introduction, and third step as the verification, you will ask the patient for the verification, can you please tell me your name? And these are the 2 options you have. Which one do you think, A or B, or do you think both are right? Comment there, which one is the right one? Angelina said B is right. Rohini said B is right. Okay, any other suggestions, anyone? Anyone think it is A or anyone think it is both, A and B? What do you guys think? Shimi has said B, Alina has said B. So I think most of you are going with B. But let me tell you, both the methods are accurate. Okay, you can do by asking the name of the patient and you can start by calling out the name of the patient. Because നമ്മുടെ സിറ്റുവേഷൻസിലാണെങ്കിലും ഇപ്പോൾ ആദ്യമായിട്ട് ഡോക്ടർ ഒരു പേഷ്യൻറ്റിനെ റൂമിൽ വന്ന് കാണുവാണെങ്കിൽ ഇപ്പോൾ ഡ്യൂട്ടി ഡോക്ടർ നോക്കിയ പേഷ്യൻ്റാണ് പിറ്റേ ദിവസം രാവിലെ നൈറ്റിൽ വന്നൊരു പേഷ്യൻ്റ് പിറ്റേ ദിവസം രാവിലെ ഒരു ഡോക്ടർ വരുവാണെങ്കിൽ ഡോക്ടർ ചിലപ്പോൾ അങ്ങോട്ടേക്ക് പേരൊക്കെ ചോദിച്ചിട്ടായിരിക്കും കയറി വരാം അല്ലെങ്കിൽ ഡോക്ടർ പേര് വിളിച്ച് സ്റ്റാർട്ട് ചെയ്യാറുണ്ട്. Okay, so likewise you can also do that. Second method is also fine. So രണ്ട് രീതിയിലും നമുക്കിത് ചെയ്യാം കേട്ടോ. വെരിഫൈ ചെയ്യണമെങ്കിൽ പേരൊന്നും ചോദിക്കാതെ റോൾ പ്ലേ തുടങ്ങി അതിൻ്റെ ഇടയ്ക്ക് വേണമെങ്കിൽ നമുക്ക് ചോദിക്കാം. ഇനി പേര് ചോദിച്ചിട്ട് പേര് വെച്ച് വിളിച്ച് സ്റ്റാർട്ട് ചെയ്താലും ഓക്കെയാണ്. ബട്ട് ഐ വുഡ് സേ കുറച്ചുകൂടെ വെരിഫിക്കേഷൻ എന്നുള്ളൊരു ആസ്പെക്റ്റിൽ വരുമ്പോൾ ബി ആയിരിക്കാം കുറച്ചുകൂടെ ലോജിക്കലി ആക്യുറേറ്റ്. രണ്ടും തെറ്റല്ല. ഓക്കെ, എയും തെറ്റല്ല, ബി കുറച്ചുകൂടെ ആക്യുറേറ്റ് ആണ് എന്നേ ഉള്ളൂ. ബോത്ത് ആർ അക്സെപ്റ്റഡ്. Yes, Alina, both are right. Okay, so that is with the intro part. So I hope it is clear to all of you. So now I'm quickly going to give you the sentences for each of the portions. So I hope all the points are clear for you. Now listen carefully and look at the task as and when I'm constructing the statements. Okay, stay with me, guys. So the second task is asking you explore patients' understanding of high blood pressure, what they know, common misconceptions, any family history. So what they know will also include common misconceptions. Okay, you won't ask a patient, നിങ്ങൾക്ക് ഇതിനെപ്പറ്റി എന്തൊക്കെ തെറ്റിദ്ധാരണയുണ്ടെന്ന് ഞാൻ നോക്കട്ടെ എന്ന് നമ്മൾ പറയാറില്ലല്ലോ അല്ലേ. നിങ്ങൾക്ക് ഇതിനെപ്പറ്റി എന്തറിയാം എന്ന് നമ്മൾ ചോദിക്കാറുള്ളൂ. And from what they say, you can understand whether it is right or wrong. Isn't it? അപ്പോൾ അങ്ങനെ വരുമ്പോൾ that misconceptions എന്തെങ്കിലും ഉണ്ടോ എന്നുള്ളൊരു ക്വസ്റ്റ്യൻ എടുത്ത് ചോദിക്കണം നിർബന്ധമില്ല, because it is understood and from the information you can what do you know about it എന്നുള്ളൊരൊറ്റ ചോദ്യത്തിൽ നിന്ന് തന്നെ നമുക്കിത് കണ്ടുപിടിക്കാവുന്നതേ ഉള്ളൂ കേട്ടോ. But family history, that's a separate question, so you do have to ask that. So you can say moving on, I would like to check your understanding of high blood pressure, so can you tell me what you know about it? So patient will tell you anything about that, and then you can say okay, and does anyone in your family have this? Simple as that. After that, your next point is explain what high blood pressure is. So you're going to explain what is given in your bracket. So you're going to say, thank you for answering what you know about high blood pressure. So let me explain it to you. High blood pressure is a situation in which there is a force of blood against the artery walls. It's a very silent condition. Often there are no symptoms initially, but gradually we will start to notice the symptoms. But I reassure you, there is nothing for you to be worried about. It's a very common manageable lifestyle, manageable condition. With proper lifestyle changes and proper medications, we can easily manage it. Do not worry, there is no immediate crisis for this condition, so please set your mind at ease. എന്നൊക്കെ പറഞ്ഞ് നമുക്ക് ആ തന്നിരിക്കുന്ന പോയിന്റ് അത്രയും കവർ ചെയ്ത് പോവാം together. Okay, so that is how you can attend task number 3. It's a pretty simple and direct one. Now, the next one is recommend dietary changes. So, since it is recommend or giving suggestions, what you can do is you can say something like, okay, I would like to recommend some dietary changes, or I would like to suggest some dietary changes, or I would like to walk you through, walk, WALK, walk you through some dietary changes that is needed. It is important that you have a balanced diet which is low in salt and saturated fats, and it is important that you limit alcohol consumption if any. Now, the reason why I added if any is because nowhere I had a conversation with this patient to check whether the patient drinks alcohol. So our communication illathodondu abruptly out of nowhere I cannot ask my patient assuming the patient drinks. So what I have to do is I have to use a general approach. I can say, and avoid drinking alcohol if you have the habit of doing that, or if you have the habit of alcoholism, or if you drink alcohol, please limit it. Or you can simply say avoid alcoholism or avoid drinking alcohol if you do. Okay, that will be enough, so you don't have to worry. Now, ingane cheyidillengil ee oru point avade parayanundu ennu munkooti kaanan pattunnathu kondu thanne you can ask a question. So I have a question to you, do you drink alcohol? So patient says yes or no, so based on that you can complete that point. Okay, so that is how you can do it. I hope that's clear to all of you. Now, after the dietary changes, you have lifestyle modifications too. So you can just use a connector like, additionally, I would like to talk to you about some lifestyle modifications. It is important that you do some regular moderate exercises like brisk walking, and you maintain an ideal body weight and follow some stress management techniques which will help you to control your blood pressure. And then you can ask the question, is that clear to you? The patient will be like, yeah, I think so. Then you can say, well, I can vouch that. Vouch, which means you are saying like, for sure, this will definitely help you. Okay, so I can vouch that these instructions will help to reduce the strain on your heart and improve the blood vessel elasticity. So please make sure that you follow all these instructions correctly for a better future, or for a better recovery, okay, or for a better management. All these words can be used here. Once you have done that, since it is a second last task, you can ask the question, do you have any other concerns? So the patient would say, well, no, I don't have any other concerns, but is there anything that I should know about, or something like that? So you're going to stress the importance of regular monitoring with the patient. So you can try to say, well, Mr. David, that's a reasonable query from your end. I would like to tell you about the importance of regular monitoring. It is important that you have home blood pressure checks regularly, and you come for the regular GP appointments as well, because we need to make sure everything is in place and there is nothing wrong with you. And it is very important that you comply to the treatment plan. Consistency with the medication, if at all you have been prescribed with any medication, is very important. And it is also important that you are committed for the long-term lifestyle changes. When you say this, it is important that you use a reassuring statement after that, because this is too much for the patient. This is a lot of information. The patient has to make some drastic changes all of it sudden. So it is important that you associate this statement with a reassuring point, something like, I know all of it sounds a little hectic for you, but please keep in mind every step forward is a step closer to your recovery, and it might sound really a little unrealistic or surreal for you in the beginning, but trust me, once you get a knack of it, it will be easier for you. We are there to support you in every step of your way. We will be there to guide you and give you suggestions and make recommendations. So please don't worry. ഈ ഒരു രീതിയിൽ കുറച്ച് reassuring statements add ചെയ്യാം. Okay, so once it is done, you can move on to the next point. Stress the goal is to prevent future complications. So you can say, Mr. David, we are only trying to help you to have a goal, help you to set a goal, which is to prevent future complications such as heart attack, stroke, or kidney disease. So please make sure that you follow all these instructions correctly for a better recovery. I hope it makes sense to you, I hope it is clear to you. I hope you understand the seriousness of the situation and things like that. Okay, you can ask any of these questions. The patient would say, yeah, that's clear to me, I got to understand that. So you can say, well, thank you very much for your understanding. Thank you very much for your understanding. I appreciate that. Okay, and then you can move on to the next topic. You can say, well, thank you very much for listening to me. So I hope everything is clear. So please don't worry too much about it. As I mentioned, everything is going to be okay. There is nothing else mentioned. Patient admitted. So what you can say is, so thank you very much for listening to me. So in case of any emergencies, feel free to contact us. Take care, Mr. David. Because even if admitted, consultation, there is no other step which is to be done next. So you can say bye to the patient. You can say, okay, then you can go home very soon. And if you have any emergencies or if you need any help, feel free to contact us anytime. That's it. This has a close end. Okay, normally, I put live activity appointment or suture removal establish the consent to do clinical observation. The context that is another activity. The conversation you're getting into the second part. Okay, so sharp. Thank you for your time. Take care. You will have to say like, okay, so can I start with the clinical observation? The patient says yes. That's the last line. Okay, because it's not ending. You're getting into the next conversation there. But in this context, it is ending because we don't see any other activities being discussed or being suggested for the patient. So we have to say bye to the patient in this context. So this is how we do that. Okay, so I hope it's clear to all of you and got an idea. So yes, Tava Mani, patient visit, routine checkups. Okay, it's on the patient visit, dear. It is the nurse who is visiting the patient because it's given you're consulting with a 62-year-old. And now where it is clearly mentioned, the patient is approaching you or the patient requested a visit with you. So unless it is given like that, it has to be taken like the nurse is visiting the patient. Okay, all right. So I hope it's clear to all of you and got an idea about how things can be done and how the intro part should be done. So since all of you missed out just one word, which is a routine checkup, you lost the idea of this being a known case rather than an unknown case. So keep in mind, it is important that you read everything very carefully before you conclude whether it is a known case or unknown case. And I hope it's clear to you about how this card can be done. So that's all for today. So tomorrow we'll be having the mock presentation. So do not miss the live because make sure that you are there to see how cards can be done, because in live we'll be showing you how two people will be sitting for the examination and how the card will be performed. So make sure you watch it, and after the live mock test we will be having the live discussions also. So make use of that. So I'll talk to you guys tomorrow. Until then, take care. Good night, everyone.